And with us now is Eric Wallis. He's the president for the Henry Ford West Bloomfield Hospital. Always great to have you with us.
Thanks for having me back, Ronnie.
So we know that it is confusing for so many people that are trying to get vaccinated right now. When it comes to your hospital entity, how does that work separately from like trying to register through the county?
Yeah, it's a great question. And as you mentioned, this is one of the bigger challenges that we faced. And I just remind folks that in the history of our country, we've never tried to do something like this. So it is very much a little bit of learning as we go. I would say over the last few weeks, we've had great partnership with both the state of Michigan and particularly here in Oakland County with the health department as we all try to figure out what's the best and most effective way to do this. The great thing about being at Henry Ford West Bloomfield is we're part of a larger system. And so the Henry Ford Health System each week has received an allocation of a vaccine that we are trying to work through and using our MyChart platform to notify folks that are right now in that eligible age group when we have vaccine to have that they can get. We're also partnered with the Oakland County Health Department and trying to support their efforts and sharing some vaccine back and forth as they try to work through their list. I think it was about a week ago in our last conversation with them, they had slightly over 310,000 people on their list, their waiting list for vaccine. And at that time, they had the capacity to vaccinate about 20,000 people a week because of the supply of vaccine. So that's really the only thing that's really making this go slower than we would like at this point is there simply isn't enough vaccine to go around to get to everybody that we want to get to yet.
So, but for the people that are working in your hospitals that are on the front lines, have you even been able to get through vaccinating all of them?
So I think we're getting toward the end of our vaccination of our team members who want the vaccine. So again, earlier in the week, Henry Ford Health System has about 33,000 folks. We've already at this point fully vaccinated about 17,000 of them. And so we certainly have, some full-time, part-time, and then some folks who work with us on a contingent basis that may be getting vaccine at another health system. So, we're closing in on probably about 60% of our workforce that is fully vaccinated. And our work right now is to continue to work with even some of our own team members who have some vaccine hesitancy to help them understand, that this is a safe vaccine and that we really do want to make sure that we get to 100% really of our own workforce.
Hey, Eric, I love that you brought that up because we are seeing that even in the general public as well. Some people are still concerned that they feel like this vaccine was rolled out too quickly. And for those that have members in the healthcare industry and they're saying, wait, I'm not getting it yet, that can kind of add to that concern level as well.
Yeah, I think you see some of our workforce has the same questions and concerns, and we're working on a day-to-day basis to even educate our team members as much as we're trying to educate the public. The reality is, especially when you talk about the Pfizer and the Moderna vaccines, the thing that has made them come out more quickly is that instead of doing the process or the development process one step and step two and step three and step four, they were all done in parallel. The federal government funded the Pfizer and Moderna companies to produce vaccine before it was even approved. So we didn't have that wait that you would normally have in a vaccine development process. And that's really what made it move more quickly. The mRNA technology has been around for decades. In fact, it's been used in the treatment of our oncology or cancer patients for quite a number of years. So we know it's safe. This just happens to be the first time that it's been fully used with a vaccine. But it was part of what was being developed back when we were talking about swine flu and bird flu and H1N1. And then when those kind of went away, they put the work up on the shelf and it was sitting right there waiting to go when COVID-19 came along. So I'll be the first to tell you, I've had both of my doses of the Pfizer vaccine. You do get a little bit of a sore arm. But that sore arm was well worth it to know that I'm protected at this point from COVID.
It really, a lot of this is about trying to educate the public as well.
It absolutely is. And so, we've been doing a number of telecast, webinars, working with our local chambers of commerce to try to, educate our business partners. We've had, folks from our health system even working in Detroit with the churches there. We've been working with, I said, with the county health department and trying to put our experts out there so that people can ask questions and that they can get factual answers. I think one of the challenges is in the world that we live is sometimes there is so much information out there that people really have a hard time deciphering it down to what's true and what may be just a little off. And so we're trying to make sure that we use our experts and put them out there. We've got, I think, a great program coming up next week with all the local chambers of commerce, where we're going to have, again, a panel of experts out to talk about the vaccine and COVID-19. So we're just trying to be a resource to the community at this point.
And that's great because also it's hard to take individual questions from an entire public because you could end up just doing that. So again, as you just mentioned, it's going to be a vaccine town hall, and that is scheduled for the 18th of February. And people will be able to tune into it right here at civiccentertv.com. And we'll have it on the radio as well as all of our other platforms as well, because again, we're taking questions from the public because someone such as myself, I know I'm at the back of the bus when it comes to the vaccine, which they're saying now could be the fall. So for me, I'm not going through this process. I'm really not so concerned because I know there hopefully will be other vaccines that will come out by that time. Personally, I'm waiting for the Johnson & Johnson because I'd much rather have one shot than two. But it is an important town hall. And like you said, to have the experts be on the panel and answer these questions for the public. And so with that, because we are talking so much about the vaccine, but we're forgetting the numbers in COVID here in the state of Michigan are going down, which for you and your staff, that has to be good, because are you not so overloaded at the hospitals right now?
Yeah, I think where we are now is we saw a little bit of a bump here over the December, January timeframe. Our numbers here locally, we kind of got to probably about half of what we saw last spring. And now we're back down to kind of where we were last summer with just a couple of folks in the hospital at any given time with COVID-19. I mean, serious enough, they need to be in the hospital. Again, I think, as we've talked previously, the great news is we've been dealing with this now for almost a year. And so we're very adept at keeping people safe while they're in the hospital. I'm very proud that, really since last April, we've not had a single one of our team members get COVID-19 from an exposure at the hospital. So, we're in a facility here and locally in this community where we have all private rooms. We do have some restrictions in place to limit the number of visitors coming into the building, but it's a very safe environment. And again, cannot stress enough that if you need care, please get it. We're still seeing too many people that are putting off routine care, screenings, et cetera, that are going to lead to much worse disease when they do finally come back to us. So continue to stress to folks that the hospital is a safe environment. We know how to keep everybody safe, and we want people to get their routine care.
That's good to know, because I know, it's like you said, so many people are holding off on those screenings, their mammograms, their cancer screenings, things of that nature, and they should not be doing so right now. With that, when it comes to going to the hospital, you mentioned there are still some restrictions about visitations. Can you tell us more about that?
Yeah, I think I'm happy to say too, I think next week we're actually going to be pulling some of those back. Just because we are seeing lower incidents within the community, and hopefully we'll be starting to communicate that later today. But right now, we are limiting, only visitors in if there's a significant need or they have a family member who needs help with, ambulating from one place to another, or, if there are certainly patients that are in life situations, we're allowing family members in. People who are having procedures, we're allowing, a family member in for those procedures. But generally, for just our folks that are inpatients with us for a few days, they can't have visitors right now. And that is a significant burden to both the patient and the family. We've tried to do some really unique things. We've been using things like FaceTime, Zoom, and others via iPads and phones to make sure that we're communicating really well with families. But it's certainly a challenge when you don't have your loved one there in the hospital. There's lots of evidence and research out there that says that patients do better when their families are with them. So like I said, I'm excited that right now our plan is next week to try to relax those a little bit and at least allow a family member to be in with their loved ones.
That will be such a comfort to so many people. And let's hope that the numbers do remain low, because we know Super Bowl was last week, so we could see a bump in some of those numbers. But let's hope that we don't, because it does appear as our numbers here in the state of Michigan, and especially in our community here, are much lower than what they are in other parts of the state. If we can go back to COVID for a moment, because everyone is focused and talking about the vaccine, but like you said, we're nearly going into almost a year into this now, and you know how to treat it better. I feel like people have stopped talking about treatments and also some of the testing for those treatments. I know that before we had a lot of trials going on for like different forms of treatment, like the plasma, things of that nature. Where do you and Henry Ford, your healthcare system, stand in that arena?
Yeah, so there's obviously Henry Ford was in the news last year for a number of studies. We continue to be involved in studies around the use of monoclonal antibodies and how those help with the care of our patients. But probably the biggest one was the study around hydroxychloroquine. That study has since been stopped for a couple of reasons. One is that we saw that there wasn't an effective benefit to the patients. And based on the fact that we were starting to do other things that were effective, it just wasn't being used anymore, so you couldn't really continue that study. I think we've learned a lot about, without getting really technical, that a lot of this is about the immune response the body has to COVID-19 and the cascade of events that can lead people downhill really quickly. And so we know how to treat that now. So what we are seeing is fewer people who are getting really, really sick. We're not seeing as many people wind up in our ICUs. I will say, though, that when we do have people get there, they're still in the hospital for a really long time. The people who do get that sick are getting very, very sick and very, very ill. And so we still are very concerned about that. I'm extremely excited, as you said, that we've seen the numbers go down here in our community and in Michigan. We were worried about a spike after New Year's, worried about a spike after Christmas, and they didn't materialize. And I think that's because a lot of folks are doing the right thing, are wearing masks, and a lot of the restrictions that have been put in place have worked. I know that none of us really like those, myself included. I'd love to go back out to a restaurant and sit and eat. But I think the reality is that they've helped us to get through this period of time without seeing big spikes.
So I had a Facebook friend who was treated and did very well with the plasma treatment. And are there currently any trials going on to continue to look at COVID-19 in your healthcare system?
Yeah, the biggest one is still, again, looking at the plasma treatments, the monoclonal antibodies, and looking at dosages and looking at frequency and some of those kind of things. We know they work. It's figuring out what are the right patients that it works in, what is the trigger that you should use to say, hey, we're going to give that therapy. So it's some of those kind of things that we're looking at. It's not so much yes or no, it's how do we best use that therapy to treat these patients.
Well, hopefully people won't get so focused on the vaccine that that they're going to stop participating in some of these trials, because I will say some of these people that stepped up to be volunteers, not just for some of those trials, but also the other ones that didn't work. They really are some unsung heroes in this, because they were willing to basically be guinea pigs for the rest of us.
No, you're absolutely right. And the other thing is Henry Ford was a site for the trial of the Moderna vaccine. And it's really been great to be able to participate in those kinds of projects to make the health of our community better. And I think that's, again, one of the great benefits of having a hospital in our community. It's part of a health system that does that kind of research. And the Henry Ford Health System is in the top 10% in the country when it comes to doing grant-funded research. So I think that's a tremendous resource that we have here in the community that we don't always talk about.
So Eric Wallis with us again here on the MegaCast. He's the president for Henry Ford West Bloomfield Hospital. The CDC recently announced that those that have been fully vaccinated will not have to be quarantined if they are exposed to COVID-19. What does that mean for members of your staff?
For the moment, not a lot. We still have a lot of our precautions in place, even if our folks that are vaccinated. We know that still today, the most important thing that we can do is mask, wash your hands, and keep some social distance. And so those things are still effective, even for folks that are vaccinated. The truth is that even with a vaccine that's 95% effective, 1 in 20 people can still get COVID, even if you've been vaccinated. And so that's a tremendous efficacy rate, but it doesn't mean that we're all protected until we're all vaccinated or until we get into that point of herd immunity. So I think, we expect that a lot of the precautions that we have in place, are going to be in place for at least through the summer. And I don't expect those to go away until we get to that point of herd immunity. Things like the CDC guidelines around quarantining help to drive our policies about any potential exposures that our team members may have when they're out in the public, and how quickly do we bring them back. But honestly, on a day-to-day basis, it really doesn't change much of what we've been doing, because we've been doing a lot of that stuff all along anyway.
So how are you doing on staffing right now? Because one thing when it comes with the healthcare industry, it's not so easy to fill some of these jobs because there's some training that goes involved in some of these positions. So how is staffing looking now and for the future in the healthcare industry as well?
Yeah, I think, staffing has definitely been more challenging. I think, a number of folks who came into healthcare didn't ever really think that they would see a global pandemic. I mean, the reality is we haven't seen this in over 100 years. And so I do think that it's taken a toll on some folks. I think we've seen some folks that were, toward the end of their career that decided that, maybe now's the time to retire. I think that the training of folks during this time period, whether it's doctors, nurses, others, has been more challenging because of the restrictions that have been in place in hospitals and healthcare settings. And so it's something that we are very focused on, is how are we going to recruit and train the next generation of healthcare folks. And again, partnerships are really important to us, through local schools of nursing. Many folks have seen in the news that Henry Ford just signed a 30-year agreement to partner with Michigan State University to help train and develop the next generation of healthcare team members and leaders. And so we're really excited about that partnership as it comes to fruition. But we are in a very tight labor market right now. And frankly, one of the things the pandemic has done is it has made acquiring labor much more expensive. We have nurses that have left our health system to go work in California part-time and make $11,000 a week. That's hard to compete with when folks can make that kind of money going someplace else. So I think it's a challenging labor market right now. We have each and every day managed to staff our hospital very safely, but definitely we're looking forward to being on the other side of this and kind of get back to a slightly more normal labor market to recruit from.
And not even so much for those that are working on the front lines, but what about just regular staffing, like your janitorial staffing, or those that work in, I don't know if the gift shop is still open, those types of positions as well?
Yeah, it's a challenge. I think we're a little more challenged even here in West Bloomfield, just because when you look at the socioeconomic status of our community, we don't have a lot of folks that work in those roles that live within the community. So we are typically trying to recruit from outside, which is a little more challenging. There are people who are afraid to come work in hospitals right now, and that has been more of a challenge as well. So, we've redesigned some of our recruitment packages. A few weeks back, Henry Ford became the very first healthcare system in the state of Michigan to raise our minimum wage to $15 an hour. I will say that was on our plans anyway. But this environment kind of accelerated that. We think it's the right thing to do to help folks be able to work for a living wage as opposed to just getting by and needing to work 2 or 3 jobs. So that has definitely helped us as well. But it's a very dynamic employment market right now.
So if people are out there listening or watching, Henry Ford is hiring.
Absolutely. We want people who want a passion to help others. And I think that's the biggest thing. Skill set is not the most important thing. We can teach you the skills that you need. What we're looking for is people who really have a passion to help other people.
Well, thank you again for being with us. We always appreciate it. And of course, we'll be speaking with you more. You will be on the panel next week for the vaccine town hall. That is going to be on the 18th at 9 a.m. Mr. Wallis, thank you, and happy Valentine's Day.
Likewise.
Thank you so much. I hope you have something special planned.
Absolutely. You've got a great wife who takes really good care of me. So.
Well, good. You guys enjoy the weekend. And again, thank you for your time.